Hi, I'm Dr. Anndrea Hatcher from Olive Branch Parke Veterinary Clinic, and today I'm going to talk about chinchillas. The average adult size of chinchillas range from 500 to 1,000 grams, and their average lifespan is 10 years. They should be kept within the temperature range of 55 to 70 degrees Fahrenheit with low humidity. They are crepuscular, which means they are active at dawn and dusk. For their enclosure, chinchillas need cages that are taller than they are wide. The enclosure should be a minimum of 6.5 by 6.5 by 3.5 feet, with a nesting box of 12 by 10 by 7 inches. They are also notorious chewers, so a cage that is all metal is best. Avoid plastic as they may chew it and ingest it. The cage should provide plenty of ventilation, so you don't want any solid sides, and aquariums are not appropriate. Provide them with ledges to jump around. If you're using fabric, fleece is the only recommended kind since it does not fray like other fabrics. The cage should be kept away from direct sunlight and drafts. It should also be in a cool area of the house since chinchillas are prone to overheating at temperatures above 70 degrees Fahrenheit. Provide wooden chew toys and a wooden house to hide in. Chinchillas enjoy a large wheel to run in. It should be at least 14 inches in diameter and not made out of plastic. Chinchillas are very messy, so this is something else to keep in mind if you are thinking about having one as a pet. So the equipment needed if you're going to have a pet chinchilla is a safe cage, wooden toys, a wooden hide house, food bowl, water bottle, dust, a dust house for bathing, Timothy hay, high quality chinchilla pellets, bedding such as Carefresh, Aspen, Pine, or Fleece liners, an air conditioner if your house gets above 70 degrees Fahrenheit, and chinchillers, which are pieces of marble or granite that stay cool. For food, chinchillas require a high fiber, low protein, and low fat diet. They rely on bacteria in their gut to digest the high roughage food that they eat. Give 1 to 2 tablespoons of high quality chinchilla pellets per chinchilla per day. They should contain only pellets, not mixed with treats or vegetables of any kind. They should also have unlimited Timothy hay. Very small amounts of fresh vegetables can be offered. Don't give more than 1 teaspoon per day of treats such as sunflower seeds, raisins, grains, dried apples, figs, and hazelnuts. Chinchillas are very active and curious. They are not very cuddly pets, and they generally do not like being held. This, paired with their very fragile bones, do not make them good pets for small children. As a defense mechanism, chinchillas can slip patches of their fur as well as bite and spray urine. Chinchillas can get easily overheated due to their very thick fur coats, so they must be kept in cool temperatures all year round. Because of the thickness of their fur, they should not get wet. It can take them a long time to dry off, which can result in fungal infections. Instead of bathing in water, chinchillas bathe in dust baths. They should be offered a dust bath daily for 15 minutes. They should have plenty of safe chew toys to wear down their constantly growing teeth. 4 to 5 inch diameter PVC pipes are good for hiding and playing. Chinchillas eat mostly at night. They also eat some of their feces. This is normal for chinchillas and necessary for good health. Chinchillas can be social and can be kept in same-sex pairs. Since they are territorial, it can be hard to introduce a new chinchilla into an established one, so it is best to buy them together. Male chinchilla's testes remain in the abdomen. The penis may be extruded from the prepuce and is ventral to the anus. In the female, the protruding urethral papilla is dorsal to the vaginal orifice, which is sealed during pregnancy and when not in heat, and the anus is ventral to that. Chinchillas normally breed from approximately November to May. They can begin breeding at an average of 8 months old. Pregnancy is 111 days, and there are usually 2 babies. Chinchillas don't build nests, but they might use a nesting box. The birthing process is quick, and the mother eats the placenta. The babies are born with fur, teeth, and open eyes. They are usually weaned at 6 to 8 weeks old. It is usually fine to keep the father in the same enclosure with the mother and the babies. Chinchillas are prone to scrotal abscesses after castration. Why this occurs more often in the species is currently unknown. Use clean paper bedding and change it twice a day for 10 days after the castration. Some veterinarians may also recommend prophylactic antibiotics. The bacteria Pseudomonas aeruginosa is part of the natural bacterial flora of many chinchillas. This bacteria is also found in many other places in our environment. It can cause disease in humans, however. Always wash your hands after handling any pet and its enclosure. Chinchillas could also spread Giardia to humans. Some medical conditions affecting chinchillas are bloat from bad feed or too many treats, bumblefoot from improper caging, malocclusion, which is overgrown teeth, upper respiratory infections, inner ear infections, eye infections, fungal infections, diarrhea, constipation, intussusception, rectal prolapse, fatty liver, kidney disease, endometritis, pyometra, renal stones, heat stroke, ringworm, fur chewing, fractures, giardiasis, penile fur ring, and urinary bladder stones. It is normal for chinchillas to have yellow teeth due to the iron in the enamel. Some also suffer from heart disease and parasites. Chinchillas can't vomit. Sometimes food, bedding, or placenta after birth gets stuck in the esophagus, resulting in a sudden loss of appetite, retching, drooling, and trouble breathing. Since chinchillas are prey animals, they hide their illnesses until they are very sick. If you notice that your chinchilla is acting lethargic, not eating, having a nasal or eye discharge, you should contact your veterinarian. Don't use penicillins, cephalosporins, lincosamides, or older macrolides, which may cause severe gastrointestinal problems. New chinchillas should have a physical exam by a knowledgeable veterinarian and have an intestinal parasite exam. They should have yearly physical exams after that.